Awesome. Well, I will start off. My name is Wyatt Tinder. I'm the communications director at NEWaukee. Thank you so much for joining this Cloud Cafe event. Milwaukee's Cloud Cafe is a multi-channel series, really to connect people in this time of the coronavirus through virtual programming and online resources and an online community. I'm so happy to welcome Dr. Magda Peck. Dr. Peck, do you want to say a few words about who you are and what you do?
Absolutely. I am a friend of Milwaukee and a friend of NEWaukee to start out with. When I lived in Milwaukee up until 2015, I was there as the founding dean of the University of Wisconsin-Milwaukee Zilber School of Public Health, which is continuing to thrive with great early impact. And currently, I serve as an independent consultant in Richmond, California. That's the San Francisco Bay Area, around public health strategies, growing strong leadership, and bringing the power of storytelling to help make social change. Prior to that, I was in Nebraska for a long time at the University of Nebraska Medical Center, where I started an organization called City Match, which is the connection of 200 cities in the country and their local health departments, much like the Milwaukee local health department, as a network to exchange what works and what doesn't to keep women, children, families, and fathers healthy. Served as CEO there and now serve as senior advisor. And also I had the opportunity there to be the founder of the first Masters in Public Health program and co-created and co-led the first school of public health there. So in short, I'm kind of a serial social entrepreneur trying to figure out how to bring people together to do really powerful stuff to make us healthier, stronger, more equitable, and live well and find greater joy with each other. So that's the snapshot. You can always check out the website, and I'm around because I'm now an auntie to Milwaukee. You know,
Yes.
I've known Milwaukee since its very first day. And as I got to know Angela and Jeremy and have been on call to you. So I'm delighted to be invited back. Thanks, Wyatt.
Absolutely. Yeah, and we recognize and appreciate local and state authority and expertise to manage the pandemic, and all of the hard work all of our area healthcare systems and providers on the front line are doing in Milwaukee to slow the spread. We've invited you, Dr. Peck, to do this cafe conversation because you are a longtime and trusted friend and public health professional who knows about Milwaukee. And we hope that you will be kind of like an Auntie M to help us make better sense of what's unfolding and help shape some strategies for seeing each other and ourselves through this all safely. So I guess just to start off, Dr. Peck, how are you doing?
Well, thanks, Wyatt. I think that's the most important question we should keep asking each other, which is, so, how are you? Let's be very clear. I have extraordinary privilege, and I am safe and well with more than enough. And it's hard in that I'm living actually in California on my own. My husband is working in Philadelphia. Our kids are grown. They're either side of 30. And grandkid elsewhere. And so this is an odd time that I'm kind of a singleton living by myself with family and friends around, but I'll come back to that later. It's a different pandemic for each of us, depending on who we wake up with or not, where we wake up and how we wake up each morning and get through the day. But I feel blessed, resilient, and determined and optimistic.
Awesome. Wonderful.
How about you? Tell how you're doing.
Doing good, adjusting to these virtual programs and working so remotely, especially coming from a team that was so close-knit. I will say over the past weekend, I developed a bit of a sore throat. So, of course, anytime you get any sort of symptom in these days, I feel like your mind tends to spiral. So that, it's just something to work through. But luckily, I have a good support system around me, and that's really important.
Absolutely. One of the things in my storytelling practice that I've been encouraging folks to do when things are very complicated and you're not quite sure what to make of it, is to write out what I call a 6-word story. Try and get it down to just 6 words. So when I wanted to share with you what my 6-word story about how I'm doing in this season of coronavirus and social distancing, and we call it shelter in place, you call it stay home safe orders. And maybe on the chat line, given the 20 or 30 people that are on this call, here's your first challenge. If someone says, how are you? Give them a 6-word story. Sum it up. Think about it. Here's mine. Figuring it out with persistent optimism.
I like that.
Do you have one?
You
can think about it and post it later.
I'll think about it. I'll think about
it would be good.
Later. That's a good.
I think it's a really helpful thing to do, because how we tell each other the story of what's happening in our lives, after reflecting a bit and knowing that storyline is going to change, or what's the subject line of the email that you want to send somebody, or what's the first sentence of your Instagram or Facebook post. I mean, that's all they're going to read for a while. And so if you can tell them in 6 words how you are, it helps us get to the heart of the matter. Tip number 1 from Auntie M.
So as an experienced public health professional who's served in leadership roles, locally and nationally, can you talk about what you're doing these days and kind of what part you are playing in this health pandemic?
Absolutely, Wyatt. Well, the first thing you want to know is what I'm not doing. In Milwaukee, there is an extraordinary cadre of local public health and healthcare and other experts and officials who are working 24/7 on keeping folks in Milwaukee and beyond safe. So kudos to Commissioner of Health Jeanette Kowalik and her Chief of Staff, Lillian Payne, who's putting out great PSAs, and John Raymond, Dr. Raymond, who's the CEO at Medical College of Wisconsin, who's giving a briefing every day in the afternoon for 15 minutes to the MMAC, the Metropolitan Milwaukee Chamber of Commerce, and to the Journal Sentinel that's putting out the stories every day that I'm following, to Milwaukee News Network that's putting out the stories, particularly from community perspectives that aren't being held. So, before I tell you what I'm doing, I need you to know that in your town, there are folks who are doing their beyond their best to follow all the preparations that they've made, working in circumstances that are not ideal, and are working to keep everyone safe. So if you have questions, we're going to be posting resources along the way in the chat box. You've got places to go. You've got great information. You have strong leadership. And I know this because I'm working with hundreds of cities around the country in my work with CityMatch, particularly in trying to understand how to keep women and children, families, and fathers safe at this time. That's my sweet spot. And so I get to see the numbers in Detroit or Milwaukee or Georgia. I follow so one of the things I'm doing as a consultant is following credible resources every day and making sure that the briefings are clear and putting word out. So kudos to Milwaukee, first off.
Perfect.
What I am doing, Wyatt, and it's, to be honest, for folks in NEWaukee, you're at usually earlier stages of your career, having had a 30, sometimes you call it almost 40-year career, because I started working in my teens, working in healthcare and later in public health and later in academia. I got to tell you, it's kind of weird not being like in charge, because others are, and having developed the leadership of so many people over the years, I have complete confidence that the folks that we trained and we grew in our leadership institute and that we graduated from the Zilber School and others, I have confidence that, folks have got it. So folks like me who are post-positional, if you will, we have influence, but not authority in our leadership. And that's an important distinction to make, especially in times of pandemic and crisis. In my influence and in my independent consulting business, I get to be the person who behind the scenes coaches and supports and mentors the people in charge so they have safe folk to get wise counsel from. It's kind of like being the conciliary, if you will, because it's hard for people who are in leadership roles to take a breath. And so I and others of my colleagues in our business are standing by and coaching folks overall. Nationally, I have the privilege, because I work on national policy, of serving on a number of advisory boards. And in this time, our advice is sought, especially around pregnancy, pregnant women, labor, delivery, postpartum care, and how infants will do specifically around COVID-19. And my colleagues and I are advising the Secretary of Health and Human Services directly as members of the Secretary's Advisory Committee on Infant Mortality. So one is to be doing the business of strategy. 2 is doing the national policy work. And 3, not to be discounted for any of us, is mobilizing in my own community here in Richmond. We have instituted at my suggestion that everybody push their trash out on Wednesdays at 6:30 in the alley behind our set of houses and condos, and we 6 feet away wave at each other and check in with each other. So it's the little things that you can do that count as much as the big policy things. So I'm working at all 3 levels: federal, state, and local, and right where I wake up every day. Everybody's got something to contribute. The key is to figure out what you can do. And I'll come back to that a little later.
Yeah. So last week, Milwaukee in the state of Wisconsin issued its safer at home order, and I'll put those in the chat, as many other states and cities across the country have done, both for like a combination of measures to slow the spread of the virus. So can you talk a little bit about what social distancing means, why it's important, and help our audience make a social distancing strategy?
Absolutely. And that's the bulk of what I want to spend my time on today. I consider me, as your Auntie M, an interpreter here, because you will get, and I think everybody should read the governor's declaration about stay home safe. And just reading it through, pretty remarkable. Somewhere around page 15, you will have the first mention of something called social distancing. And I'm actually going to read it because, who's going to get to page 15 of a governor's order, although it's there, and I want to make sure that you get the information from its direct source. It says, it's requirements that maintain social distancing of 6 feet between people, washing hands with soap and water for at least 20 seconds as frequently as possible, or using hand sanitizer, covering coughs or sneezes, and especially sneeze into your elbow but not into your hands, regularly cleaning high-touch surfaces, give up shaking hands, follow all other public health recommendations issued by the State Health Department and the U.S. Centers for Disease Control. So that's the formality of it. But I want to talk for a moment about social distancing, about why we do it first. Because if we're asking you to wash your hands often with soap and water, if we're asking you also, what he's not mentioned there is, I just washed my hands before this, so and you'll notice I have allergies, and so I'm scratching my eyes. I have a real setup here, so I have to be very careful that I don't touch a surface that has not been cleaned and then touch my face. So that's why we're also trying not to touch your face, particularly your eyes, your nose, your mouth, if you haven't washed your hands. you want to stay away from people who are sick. So why you didn't have company before, but you definitely don't have company now with your sore
Yes.
throat. And I don't expect it's going to be anything worse, but this is the time for you to be extra careful on how far you stay away from folks. Always cover your mouth if you do sneeze and start to cough. And there is something about whether you should use a mask, particularly if you have any symptoms, yes. And there is some argument now, both locally, nationally, and globally about masks because they're in such short supply, and I can come back to that about how effective they are. But these behaviors are about this stage of the pandemic. So I want to take a step back for a sec. And the step back said, when it first erupted in Wuhan, China, which was reported back in December, January, nothing happened here in the United States. And nothing happened here for a really long time. And so the period of time in which you could actually try to find every case as it popped up, and then isolate and quarantine every individual case, and then find all the people that they've been in touch with. This is classic case finding, public health epidemiology. We used to call it gumshoe epidemiology. You know, epidemiologists are medical detectives. They try to track down who's been exposed, who's got the disease, who might get it next. And so that depends on having a lower number of cases and catching it early before it spreads. That's what we call containment. And containment didn't really have a chance to take hold here because we weren't able to get a handle by either tracking it down or testing to know who's been exposed, who has it, who have they touched, what have they touched, right? And so the two phases that you look at are containment, and then you move towards another phase called mitigation. And so I just think it's helpful to know the difference between those two words. Mitigation kicks in when it's no longer possible to contain it in one place or one family or in one part of business. You heard of a case perhaps in Washington where a choir decided to meet and they all sang, all 60 some people, and now 40 some, when they gathered, are ill, and some of them quite severely. Now, that happened without any of the social distancing being put in place yet. It was before we knew what to do and before people started to do it. And if it had been just that, then we could have contained that outbreak or that nursing home. But it's just cat out of the bag. So we're part of mitigation, which has the following parts to it. One, then people get sick, you got to treat them medically, which is why the healthcare system is just being flooded in some parts of the country and will be flooded beyond current capacity. And not only capacity of beds, but enough doctors and nurses and other healthcare people and the personal protective gear so that they don't get sick and they don't spread it from person to person. So you need all three things when you put hospital care together. And it also calls for developing treatment. So when you go into containment, it's like, let's get a vaccine. Let's get a cure. Let's get something going. And that takes 12, 18 months to do. It's not going to happen like that. But that's when you go from containment to recognizing we have a whole population, a whole nation, in this case, the whole world, aching for some level of antiviral drug or vaccination that can be taken, some treatment. And the third thing that happens when you move from from containment to mitigation is it's called non-pharmaceutical interventions, NPIs. Frankly, someone came up with a name called social distancing, not my favorite, because it's not necessarily well understood, but it's taken off. And what it means is all of the behaviors, not that individuals alone do, but that everyone has to adopt, so that you break the spread from person to person, from touch to person, in such a broad way that we can slow down the spread, called flatten the curve. You've probably seen that. And then it means that you spread out when people will get sick, and fewer will, so that you don't overwhelm our ability to treat them. And ideally by then we've got a vaccine or an antiviral drug that will do the trick. So all of that is in the area of mitigation, and social distancing is on the side of what not just I have to do, but we have to do it, and we have to all do it, and we have to do it all right and the same way, and agree to hold ourselves and each other accountable for this set of behaviors. It'll only work if everyone does it. It's only as weak as the chain that's not connected to the next. So we can't have those links not there. So I'm going to stop there for a sec, because it's something that got thrown at us literally in 4 weeks. Like, whoever heard this term before? Mm-hmm. And now it's something we're expected to do. So I was wondering, I'm going to tell you a little bit about the history and a little bit about what we know about it, and some more information you can get about it, and a tool we can use to figure it out for ourselves. But comments you want to make about social distancing? How's it worked out for you?
It's worked out. I mean, I'm lucky in that I'm socially distancing with someone. So my partner is here with me. So I feel lucky in that. And I think also privilege in the tools and technologies that I have that allow me to stay connected with friends and family members. So that all helps manage better.
Thanks for that. And this is where in our chat box, I know you're monitoring, and I'm going to pull it up. I really appreciate that people have put on so Jen, thanks. Working on being positive through it all. I love your 6-word story. Thank you for that. And others are welcome, and your questions are welcome along the way. Let me go from the theoretical to the specific, if I could, because I want us to use our time well together. The bottom line is that we don't have any cure for this disease, and it is spreading quickly. So we need to be able to break it down into the actions that we agree to follow, and in language that makes sense to us. So the notion of staying at home, hugely important to do. Or stay in place. And the words in California are shelter in place. And I live in the area which did the first mandated shelter in place order. And I'm on week 3 now. And we've just been given the national orders that maybe now, not by Easter, but by the 1st of May. And it's just like getting your kitchen done. If you ever had any kind of modeling that you lived with, it's like home improvement. Add another month onto that, just in case, so you should be thinking about a day at a time, a week at a time, a month at a time, and maybe more than that. So how long? So you pace it out. It's been said again and again, this is not a sprint, this is a marathon. So I want to also just acknowledge that in this social distancing, we both mentioned our privilege, and particularly my white privilege that I add on it. And I'm so mindful of the underlying issues of equity and structural racism. And so with my humility, I want to acknowledge something that was said by a communications director, actually with Planned Parenthood Federation of America, on a webinar, which I will give the link to for you to put up later. That was done in combination with what's called the American Public Health Association and the National Academy of Medicine, kind of like the top repository of all things coronavirus at this time, but also the top docs and top public health people in the nation. What Mitch Stripling said is, he said, restrictions without support make the disease less visible to the privileged and push more disease to the most marginalized. And what we mean by that is, when we tell people to stay home, we have an assumption that we're making that often can come with implicit bias, that you have enough food, that you are safe at home. And there's evidence of greater home violence, domestic violence, and others that are playing out, that children who sometimes find their greatest sanctuary at school are now in home. You're now in a crowded home, and that makes for greater tensions within a household. It assumes that people can stay home and not work, meaning those who have essential jobs still need to leave and then come back. For people who are in small business or working in service jobs, it's devastating to whether or not you can pay your rent on the 1st of April. So there are lots of ways in which this order plays out differently for each of us overall. I have encouraged people to be thinking about their blessings and gratitudes every day. Ask whose experience might be different from yours, and lead with curiosity and compassion about how you can be more helpful to those with less. And I also want to pose a question to you. And the question is this: who are you social distancing for? My colleague, Molly O'Dell, who runs the Roanoke district in Virginia that has a large number of cases, and Liberty University, are aware that people need a reason to do this. And so sometimes if you're feeling like, oh, I gotta, you can reframe it and say, why am I doing this? And for whom am I doing this? For me, I'm doing this primarily for my granddaughter Eleanor, who lives in Omaha, because I plan to see her go to her prom and get married, and I have no intention as someone who's 65 in being a high-risk category with underlying asthma and putting myself at risk. So even though I normally would be on the front lines, for Eleanor, and I would encourage all of the folks on this call or who might be streaming later, make that note in the morning about why you're doing this. You know, who do you love? Because 6 feet distance is an act of love. It's a way how we can frame it.
Yeah, perfect.
So I wanted to leave those pieces, and I also wanted to make sure that people have really good information about where they could go to after this. But looks like there was one chat that puts it out there. More about masks. I'll come back to that in just a sec. Thank you, Leona, for reaching out to people. Really appreciate your comment. Yeah. What else, Wyatt? So that's the social distancing. It is a series of behaviors that we agree to adopt religiously, no matter what, all of us. And at the end of the day, here's the deal. You should be able to say, if someone you know gets sick, or God forbid dies, you want to be able to say, I did everything I could do. Shortcuts on this one do matter. It's not about perfection, but it's get as close to doing all of the things that are put out there about hand washing, 6 feet, cover your cough, stay at home, stay in touch. What do you think? Does that cover it for you? Because I want to go into a quick, I do want to offer one more thing and then maybe go to a quick exercise. Would that work for you?
Yeah, let's do that.
Okay, so the most radical thing that you can do as an act of love is to take really good care of yourself. So this would be a really good time, given that we're about 30 minutes in, and literally for 30 seconds, I'm going to ask you to take 3 breaths. And when I say that is that we can get really wound up in this. And the more we have the ability through mindful meditation, through purposeful breathing, through an opportunity to stop and reflect, bring our heart rate down, bring our voices down, bring the intensity down, we'll pace it. So I'm going to take 3 breaths, and I invite you to take it with me. And these breaths, you're going to count in on the count of 4 and out on the count of at least 5. Here we go. Lowering your shoulders a little bit. Again. One more. All of that can bring the temperature in your body to, meaning your emotional temperature, a quieter place. So if you find yourself getting wound up, find a breathing buddy if you can, or just do it on your own. A couple times a day makes a difference. Okay, so I want to introduce to you a way of thinking about social distancing that I created when we first started this thing 3 weeks ago in the San Francisco area. Living by myself, I realized that, and I don't have a dog or a cat or a parakeet, and there are no dogs to be fostered because everyone has taken every dog in foster in every shelter has been claimed, which is extraordinary. I know that Ann Reed, who runs your Humane Society there in Milwaukee, said the same thing. People are stepping up, A, because it's the right thing to do, and B, because it feels good to cuddle. So I created essentially an exercise. And if you have a piece of paper, here's what I'm going to encourage you to do. Take a piece of paper and a pencil. And you're going to have a blank piece of paper. And you're going to draw 4 circles. 1 circle, and a circle around that, a circle around that, and a circle around that. And it looks like this. I'm going to try to put it up here. Does that more or less come to you?
Yep.
Can you see that, Wyatt? Does that work?
Yes, I can see it. Yep.
Okay, and so the first circle is number 1. Second circle is number 2. Third circle is number 3. Fourth circle is number 4. That's obvious, right? I didn't go to Harvard just for that. Okay, so, and here's how I think about those circles. In your first circle, put that as the circle of touch. The only people in your first circle are the people who you can touch, and they can touch you for the duration of this pandemic until we ease the social distancing, because it's not going to be like a switch. How we cut it off is also going to be as important as carrying it out. More on that later. So 1 is Wyatt and his partner, my sister and her husband, my neighbor, her husband, her mother, her 3 kids, all under 5, living in a 3-bedroom apartment. It's very tiny. You know, whoever that is, you decide who's in your first circle, and you make an explicit agreement to say, we are first circle folk, and we're going to do everything we can to make sure that we keep each other held and safe. Now, in this overall, in this social distancing map, the second circle is what I call the in-touch circle. The in-touch circle are the people that you are going to have agreements with. Your agreements may be with your family, your friends, your neighbors, some of your closest coworkers, your buddies. I mean, the people who you trust. And you are your mutual aid. You're going to proactively agree that without fail, you may be 6 feet proximal to each other, but you will not violate the rules of social distancing. You're also, if you can't be 6 feet because they live in, say, California, you're going to also agree to be virtually in touch. Yes, call your mother. I know it sounds silly, but the bottom line is my son in DC, 30, you know, he's like, Mom, I'm calling you. not because I have to, because I need it too. Be in touch. Zoom helps. Have Zoom parties, have virtual happy hours, be creative, find games you can play online together. Whatever it is, you have check-in. And between your first and second circle, the most important is make a plan, because if you get sick, these are the people who are going to take care of you. And if they get sick, you're going to be there to take care of them, either by touching them or bringing them soup or helping them make the decision with their physician, or call their physician, and then as needed, get tested, and as needed, go to the hospital. So first and second circle. Your third circle are your connections. They're the people who you've got to get work done with. They may not be available for emotional support, but be kind to them and gentle. If they get gruffer and more tense and it's harder to work with them, well, yeah, it's a harder time. So your job is to be on point, be efficient, use your time well, and stay and get the work done that you need to get done. It's your essential group for essential work and your connections to operate your life. The fourth and the last is your network. Your network is what you belong to. NEWaukee is your fourth circle. There are people in Milwaukee that you might have in your second circle, but NEWaukee serves at you, like this cafe and the other things that they're doing, as a place where you can belong, that you can get information, that you can be creative, that you can co-create community. You have others. Maybe it's your place of worship. Maybe it is websites that you are going to subscribe to, that they're going to send you in your box every day, something about coronavirus. Intentionally construct your fourth circle as the places that you're going to be regularly have as a resource, and that can be offering you stuff, whether you take it or not. So is it me and mine? Is it us in terms of our second circle? Is it specifics in our third circle? And then the fourth circle is, if belong and know where you belong, and which organizations and groups and networks can you count on to get good information. This is an inventory that I tend to put out. And in this inventory, I literally, for myself, I've mapped out who in my life at this time is in my first, second, third circle. What do I really need to get done? And what am I going to just say, folks in my third circle, you know what, I can't do that work now. It's going to have to wait, or can we push the deadline out a little bit? And then fourth circle, I've been making sure I keep my memberships and show up. So Wyatt, when you first heard me go over this with you, what'd you think? Did it make sense to you?
Yeah, I think it makes sense. And I think what's really important more so is just putting together a plan so that when you have to have tough conversations with family or those types of things, that you're prepared and that you're ready to have those conversations and make those agreements. I think if you're not clear and you haven't thought through that, you might get into a situation where a sibling or a parent or someone in your family is saying, "Oh, can I just pop in? Can I stop over?" And there's that boundary that you have to have there.
Mm-hmm. Brilliant. That's exactly right. This allows you to set your boundaries with intention and with strategy, and check in on it over time. I have been getting calls from nieces and cousins that are younger that are saying, my dad, like, he's going to the grocery store, he's got lung disease and he's 70. Like, can you tell him not to do that? Well, those are hard conversations to have. And as you express social distancing as, I love you, tell me how in second circle we're honoring each other's commitments to stay safe and strong. I'm curious about what you're thinking about. Mm-hmm. This is a time that curiosity would be a whole lot better than judgment. I wouldn't write the story about them without them, and really listen to why, and then make the case. If somebody is in your second circle, not virtually, but actually you set the boundary. You declare who can be within 6 feet of you, and who gets to answer the door or not. Let's keep going, because we've got a little bit of time left to go to the top of the hour, and I wanted to move on to some questions that you had about how do we deal with all this information? What do you want to know, Wyatt?
Yeah, I think there is a balancing act. You know, you want to stay informed, but you also want to maintain your own self-care and manage your stress. So I guess, what would you say to people in terms of setting boundaries around staying informed without obsessing and causing all of this stress?
Bottom line is that there are two kinds of stress here that I want to honor. One is the stress of three kinds. One is the stress of the immediate situation with coronavirus. It's not that it's not going to be stressful. It is scary. It is a lot of uncertainty, and it's changing every day. So as the numbers start to escalate, I was just looking yesterday on the CDC, 140,000 cases, almost 2,500 deaths. This is, and we're not at the peak, which likely will not be until the 15th of April or so. So we're literally got 2 more weeks of watching and hopefully not going at the same curve as Italy and lowering the curve overall. So within that, some radical self-care is helpful. Breathing, as I mentioned, if you meditate, this is a good time. There are lots of apps that really can help you through this. You can structure your day. One of the things that happens that's so disruptive is that suddenly you're home and all that, like the refrigerator's there and the TV's there, and there's a really book that I wanted to read, and so how do you create each day your own agenda, and in that agenda for yourself, you're making a date for yourself for self-care, 30 minutes at least outside. And if you're going to walk, make sure you're walking 6 feet apart. If you're going to parks, I know in our part of the country, parks have been shut down and beaches because people were partying and not respecting it. And so if you're going to be near folks that aren't going to observe, makes it hard. Sometimes it's helpful to walk with someone so you can dually reinforce each other, but make sure you get some outside fresh air time. Figure out the 3 people that you're going to call that day, or ask to set up a time to structure your Zoom calls in during the week so you have something to look forward to. A little structure helps break the sense of monotony, boredom, uncertainty, and rootlessness. Now, the last piece is that there are folks who are stressed about stuff already. How was I going to pay the rent? Did I have enough food? So I want to recognize that this is more stressful for those without enough. And if you want information in your town, the health department has information. You can dial 211. 211 has been structured to be a one-stop shop in Milwaukee to get you the basics that you need. So recognize that this is current stress, and then there's underlying stress. Maybe you weren't getting along with your partner, and now this is really going to accentuate it, especially if you're living together or not. Being creative is helpful. And then there's the chronic stress, especially in places with high levels of segregation, where communities of color, and particularly African Americans, have experienced chronic cumulative stress from systematic and institutionalized racism that are playing out in this time as well. So stress is not the same for everyone. It can be chronic from generations before you in the form of stress and trauma. It can be current in your life already, and now this. And so give yourself a break to do radical self-care, if you will, and make sure that you're doing what you can do to eat well, sleep well, breathe well, walk well, and connect well. those are some things that will come to mind. And you've seen lots of things on the internet, and we can put more out there that are ways to do that. But make a plan for it. Make a plan for it.
Does anyone in the chat have any more questions? Let me see.
Yeah, I really, 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 really love some of the things that have been put up there. I want to talk for a second because I don't see questions coming out yet. I want to thank you for posting some things right now. One of the things that you will find is information overload. I get paid to monitor everything that Dr. Anthony Fauci says. I have found that I need to know what is said at the president's briefings. I personally find them toxic. So I'm judicious about whether or not I subject myself to misinformation, disinformation, and falsehoods, which are a regular part of that staple. I prefer to wait for the interpreters to come and tell me what's really going to happen, such as Tony Fauci. I trust him. I know him. He has served 6 presidents. And so if you hear something that Tony Fauci says, believe it. And there are a lot of bots and bashing right now of him from those who have brought into conspiracy theories and other ways of interpreting this pandemic other than what it is. And I am hoping that truth and science and fact will always outweigh the concerted disinformation that sometimes falls along ideologic lines. This is a time for finding common ground in what we know and do, and not politicizing the virus or the pandemic, which is being done and will be done, and we don't have to succumb to that in our own behaviors. I want to also emphasize that there are places that you can get really interesting if you're like data geek. University of Washington, Chris Murray, one of my colleagues out there, used to be at CDC. He and his group are doing modeling about what does it look like over time? When is this thing going to end? And they're doing modeling based on information all over the world. And they're metrics people. So if you do want to get into the weeds, that's a reliable source. Another really reliable source that's tracking every day and consolidating is at Johns Hopkins University, and that's also been posted on your chat. They consolidate every article, every case that's been reported worldwide, every state. So there's that. In addition to going to Wisconsin and Milwaukee's governmental portals, which have also been put out. But some people feel less anxious if they feel like they're getting all the information. So if you want more, it's out there. Just make sure that you're getting reliable, scientific, evidence-based information. Let me respond to the question about masks, if I could.
Yep.
Good question. So the World Health Organization and the CDC have been saying the same position, which is the purpose of a mask, and I'm talking about a mask that is clean and properly constructed and properly applied. So it's not just the mask, it's what kind of mask, when you use it, and how you use it. So proper protocol with masks is given the shortage of masks in the United States, and the notion that there's a shortage of personal protective equipment is, for those who've been modeling pandemics in my world of public health, they just, not all of them thought it through. And so been hearing from folks who've been doing tabletop modeling and preparedness exercises. They assumed that the stockpile had enough and didn't necessarily check the inventory. And they assumed that it wouldn't be left to the private sector, that there would be a coordinated federal response, not, okay, Wisconsin, you figure it out. You know, I had a briefing the other day about masks with the governor of California. And he said, you know, when we did the projections at the peak of the epidemic, the number of masks that will be needed in the state of California is 1 billion masks. Like billion. Like, I'm not talking million. We're talking like billion as in Jeff Bezos' billions, right? Right? This is huge. And so the little that people are producing, either whether it be by 3D production or repurposing a GM plant or going into the stockpile and seeing what's there, or procurement under huge contracts from China, it's piecemeal right now. So I wanted to just say, so it's a production period. And you, if you are not symptomatic and you don't have a cough and you're social distancing, the mask that you're wearing is something that somebody else who's on the front line can use. So during a shortage time, give it up and give it to someone else if it's the proper kind of mask. Now, there's a second rule of thumb coming out about, well, in some countries, say South Korea, or in the Asian countries, everybody wore a mask. It didn't matter if it was the right type or kind. It became a social behavior. And when it became uniform, it actually became discourteous. Somebody was seen without a mask was seen as violating not necessarily science norms, but social norms. It was a way to remind us to behave with each other, to stay 6 feet apart, to cover our coughs, to not touch our face. So that the masks that you see people making and wearing right now may not be up to hospital protection grade. And if you choose to wear it, there is no harm in wearing those masks that are self-made or locally generated, because it can help you and others behave socially in ways that we need to have happen. And it may make a difference, but they're not necessarily foolproof. So there is no standard recommendation that everyone should wear a mask. It is about people who are very high risk, have symptoms, or are being exposed on the front lines. And it's a lovely effort that Joanne Fabrics is giving away fabrics for people to get out their sewing machines. Don't stop that. That's a great community effort. It is not going to meet the healthcare system's need, but it may make folks feel more comfortable. They're doing something, remind each other to stay apart while being together in this. So it's a difference between the rigid science and clinical care and the activities of our daily lives. Why, does that make sense? I'm just trying to play that out. Any questions that you want to follow up on that? Want to make sure that our folks on the line had a chance to see that.
No, I think that makes sense. I think we might have time for maybe one more question.
Okay. Well, here's what I want to do as we're at right about time. I want to acknowledge two different groups that that I want to call out as absolutely essential to give special attention to in Milwaukee as we come to a close. The first is women and children. If you're sexually active, this would be a really good time for you to be intentional about whether or not you want to be pregnant or not. And to be really thoughtful about that for people who, of course, are going to be in your first circle. They're not in your first circle, going to be creative dating for a while, and absence hopefully will make the heart grow fond, or at least my husband and I are going on dates these days. Been fun. So I want to put out that in this time, however, women who are getting ready to deliver around this time will require some special considerations in hospitals. And we nationally are putting out recommendations to moms, and that's in the chat box. The New Mom Health will tell you what you can do if you know somebody who's pregnant. It's a great resource. There's also one called the Fourth Trimester Project. So pay special attention to what you can do. And we're pushing the greater use of midwives and doulas and freestanding birth centers, and separating out with adequate support and not delivering alone. So know that we're pushing on the front lines for pregnant women and women ready to deliver and home visitation, and how do we handle that? So just know that we're paying attention to that nationally. And last, and certainly not least, that there are those that are at greater risk for whom this pandemic is hitting harder. The initial deaths in Milwaukee are disproportionately on the north side, and the folks of color. And we need to be mindful how racial equity plays out in quarantine. There, those have called it a quarantine within a quarantine for those who've been isolated and have less than enough to manage this. And so with my white privilege, I want to acknowledge that my assumptions of how I can do distancing do not work for a whole swath of folk, and disproportionately that may play out in communities with less, communities at higher risk, and communities of color. And I'm going to follow the leadership, and you have extraordinary leadership in communities of color there, about how folks take care even better and more mindfully and with greater commitment to eliminate the disparity. So I want to put that out there and pay attention to that gap, because it will get even greater now, and be mindful of how inequities are playing out at its worst, and will play out in Milwaukee. My final things for you, and then he's got some closing remarks to you. I want to put it out there. If you have additional questions, I am more than happy to be able to do follow-up through NEWaukee as your Auntie M. But you may want to place your questions directly to the folks locally. So call 911, 211, that's 211. Check out the links that we've had there to see if your questions have already been answered. And then as a fallback, be glad to direct you to your local expertise that can answer your questions as well or better than I can. This is a time of persistent, sometimes unwarranted optimism. That's what my mentor taught me, Bill Fahey. He was responsible for the eradication of smallpox in India. We can do this. We've got this, because we've got each other. And what a time of possibly uninvited possibilities, uninvited gifts that never would have been possible. Let's seize those as well. Thanks to NEWaukee for inviting me to be your Auntie M, to try to make some sense out of complicated stuff. And I wish you all the best. Stay safe, stay at home, stay strong, stay connected, stay well,